Respected chair, moderator, presenters, and audiences, greetings of the day. First of all, I would like to thank Global Communication Research Association for organizing such a time-befitting conference and inviting me to present my research paper in this thematic session on pandemic and culture. Myself, Jewel Dash, Assistant Professor, Department of Journalism and Media Studies. You all are welcome to my presentation. The title of my presentation is Socio-Cultural and Behavioral Dynamics of COVID-19 in Bangladesh, a CAP approach. Basically, this study was funded by UNICEF Bangladesh and Bangladesh Better. I would like to thank both organizations for supporting and coordinating during my study. Let me start by giving some background information on my study. The recent data shows that COVID-19 new cases and death toll both have decreased in Bangladesh as the rate of community transmission of coronavirus is declining in the country. However, experts view that community transmission of coronavirus has close relations with socio-cultural and behavioral context. So unhealthy socio-cultural and behavioral practices might trigger increase in coronavirus confirmed cases in the country. In this regard, a better grasp of community members' knowledge, behaviors, and socio-cultural practice is considered an effective intervention to bring positive health outcomes. Further, extensive knowledge supports a positive attitude and the right practices, which helps to reduce the risk of individuals' infections with the coronavirus. In this regard, this formative local study would generate evidence regarding the socio-cultural determinants and behavioral risk factors that might be responsible for coronavirus increasing trends in Bangladesh. A number of literatures were reviewed as part of the study in a cross-sectional research undertaken to investigate people's knowledge, attitude, and practice on COVID-19 outbreak in Bangladesh. The researchers discovered that 48.3% of participants had more correct knowledge. Another study titled Acceptance of COVID-19 Vaccine and its Determinants in Bangladesh found the reasons for people's unwillingness to take vaccines immediately were anxiety about the side effects or safety of the COVID-19 vaccine. In a research, researchers demonstrated that hand washing and mask use was higher in the United States and Europe than in South Asian countries because of the disparity in these countries' socioeconomic conditions. So, most of the reviewed papers focused on individual aspects of COVID-19 risk factors and impact. In this study, we attempted to conduct a comprehensive investigation into the socio-cultural behavioral aspects of COVID-19. These are the core objectives of the study: find out the responsible socio-cultural causes of increasing trend of COVID-19, describe individuals' practices of maintaining safety measurements of COVID-19, assess individuals' level of knowledge, attitude, and practice on COVID-19 vaccines, and analyze the COVID-19 related behavioral practices of community members. This study adopted CAP model as a theoretical framework and also undertaken quantitative and qualitative research approaches. The study conducted in 5 sub-districts of Chittagong district. Chittagong is a southeastern district of Bangladesh. In the first step, a quantitative observational study was conducted. In total, 575 people were observed during the study. Undertaking time sampling and event sampling, 8 public places from each of the 5 sub-districts were observed. In total, 40 public places were observed as part of the observational study. In the second step, through a convenient sampling, a quantitative vaccination survey was administered on 202 people. In addition, based on purposive sampling, 20 qualitative in-depth interviews with key informants had been conducted. The slide shows the findings on quantitative observational study. The findings on face mask wearing behavior of observed people indicates that most people ignore mask wearing practice in the public places where they come to direct contact with the public. The percentage is 52.52% people. They wear mask, but significantly 47.48% people didn't wear mask when they were in direct public contact. And an important thing was found from the study, and this is the females had good practice toward wearing face masks comparing to male. And the percentage of female who wear mask, it was 69.33%. The observational study also observed people mask wearing positions, and the study found that more than 1/3 people did not wear mask in the proper position. The observational study also found that out of 40 observed places, there are no hand washing and hand sanitizing facilities in 52.5% area. And on the other hand, there are no mechanisms for physical and social distancing in the observed area, and the percentage is 82.5%. And the study also observed on the awareness message regarding COVID-19 and found that there are no awareness message or guidelines in 2/5 of observed public places. And the types of the awareness messages are poster, leaflet, signpost, notice, or guidelines, and awareness sticker. The vaccination survey indicates that the participant, the majority of the participants know that getting vaccinated against COVID-19 protects them from being infected with the virus. The survey also indicates that 15.3% of participants did not know where their nearest immunization center is situated. The major sources of vaccination information for the respondent are television, newspapers, posters, health service providers, and social media, so on. Participant attitudes toward COVID-19 vaccination, vaccination found that more than 1/5 of the participants reported they did not think after getting vaccinated they might be infected with coronavirus. And majority of respondents, the percentage is for 84.5%, thought that only vaccines will not turn off the pandemic automatically, although a substantial portion of individual negative attitudes toward vaccination and other health measures. Some people were unwilling to maintain health safety measures after getting vaccinated, and there are some reasons. The respondent indicated that they feel that vaccine protects from being infected to corona forever. Vaccine creates antibody in their body. Wearing mask and keeping physical distance both were boring for some people. That's why they after getting vaccinated, they are not interested to follow health protocol during the COVID-19. The vaccination survey also undertaken on the practices of COVID-19 vaccination and found that the majority of people found that more than 3/5 of respondents have been vaccinated either fully or partially. By contrast, almost 2/5 of participants have not been vaccinated yet. There are some associated factors for not practicing COVID-19 vaccines, and the table shows that. The qualitative in-depth interview data were analyzed in 5 themes. The theme 1 on COVID-19 related knowledge, awareness, information, and the study found that people had mostly positive knowledge. Social perception and attitude towards the spread of coronavirus. And theme 3 was attitude towards local administrations, NGOs, and medical systems. And the study found that NGOs and public health bodies can be contribute more in COVID-19 interventions. There are also two themes: practicing health-related behaviors and behave to motivate others. And many informers said that usually they try to motivate their colleagues, family members, and friends to wear masks and to be vaccinated. But frustratingly, community members sometimes ignore such suggestions. So this is the conclusion of the presentation. So we know that knowledge is an essential predictor of social attitude and behavior practices towards COVID-19. But people in the studied area had a fair knowledge of COVID-19, but there are some gaps, and there are some reasons behind this gap, because there are unequal distribution of COVID-19 related knowledge, and that's why some people did unhealthy social attitudes and behavioral practice, but the behavioral practice, but they had to do healthy behaviors, but there are knowledge gap, and there are some social rigid attitudes or the rigid behaviors responsible for not doing healthy behaviors for protecting themselves from being infected of being infected to coronavirus. So this is the references to transfer. So thank you all to listening me. Thank you.